queer umbrella. One of them would be a gender nonconformist. And then there are also other types of conceptualization, such as two-spirited individuals, which has historically Aboriginal roots. And so there are many ways to conceptualize gender, and that's what we're going to be looking at today. Lastly, transition is really the process in which the gender diverse individual goes about changing their body and their appearance. And there are many ways for somebody to transition. One of them is a social way. We'll talk a bit about that later. There are medical options as well as surgical procedures. All right, so I'm not sure how many of you have been taught by me, but I used to play this game that if you could answer the skill testing question, I would throw you a candy in the audience. And I've only heard one individual in doing this over many years, so I think it was you, Nina, and I apologize. Oh, it wasn't? Okay, good. So I just thought we could maybe see if somebody in the audience could yell out one of the movies you see familiar with, and I'll throw you a candy.
Boys Don't Cry.
Boys Don't Cry. Oh, were you talking about the movie or just, oh yeah. Good. Okay, anyone else? Dog Day Afternoon, who said that? Oh, Jen, right at the very end, I apologize. It was a perfect throw, terrible catch. And the last one.
Crying.
You ruined the ending for me, thank you. Good, inside joke. So what is gender dysphoria? Gender dysphoria, by definition, is this discomfort and this distress that is caused by a discrepancy, a difference, a mismatch between the person's gender identity and who they really think they are internally, and the person's sex that has been assigned at birth. And along with sex is all the associated gender role and primary and secondary sex characteristics. This discomfort or distress is often so intense that it becomes the most important and pervasive aspect of this person's life. And this is why we often see them in our clinic, because it reaches this level of clinical intensity. So we do have traditional binary gender models, and many people are raised, and many cultures are sort of focused on this being the norm. And I think we're at the cusp of a really interesting point in human civilization, and certainly North American society, possibly the evolution of what it means to be a human being. We're really challenging this traditional binary gender model, where you have a dichotomous male or female who then have respectively masculine and feminine traits, and then are attracted to the opposite gender. And in this sort of bizarre utopia, everyone is heterosexual and everyone is just basically exactly the same, although we know this just isn't real life. This isn't the case. And really, when we start looking at it, we can really start adopting some very revolutionary gender models. And you can see that the language and some of the relationships gets a little bit confusing for most of us who have learned these very linear models. But you can see that there are many different combinations of how you conceptualize yourself and other people, and it sets up for really a lot of very different sort of ways of looking at relationships. I've included some things in there, such as pansexual, the very, very bottom right, which is the idea individuals are attracted to all humans regardless of any sort of labels. So there's no gender labels, there's no sex labels, those kind of things. That might be a new one for some people as well. But you see that things get pretty complicated. And this is part of the fun of being in the Good Day Clinic, that we get to help some of these kids and teenagers and families navigate some of these type of dynamics, which are much more abstract than most of us are really ready for. So depending on how sympathetic the audience is, there's usually lots of laughter or no laughter. And so I like the fact there's a medium amount of laughter today, so that's okay. Some of you are probably doing some paperwork and other things as I'm speaking, so I'll forgive you guys. But this is a pretty important message for a lot of people. I think we have to really recognize that we're all walking around being very judgmental, trying to figure out, well, who's that person? What's that person doing? And we're rarely asking, are they good people? Are they happy people? Are they making positive differences to themselves and the people around them in the world? And I think those are more fundamental characteristics than